How does PCR testing work for leukemia patients? Imagine a tiny detective working behind the scenes to find clues about leukemia in your blood or bone marrow. That detective is the polymerase chain reaction, or PCR, a powerful tool used to spot specific genetic changes linked to leukemia. It works by copying tiny pieces of genetic material, either DNA or RNA, from your blood or bone marrow samples. This copying process is called amplification, and it makes even the smallest amounts of genetic abnormality easy to detect. In leukemia, certain genetic changes happen inside the cells. For example, in chronic myeloid leukemia, a specific abnormality called the BCR-ABL fusion gene forms because of a translocation between chromosomes 9 and 22. This fusion gene produces a unique RNA transcript that is different from normal cells. PCR testing can identify these fusion transcripts with high sensitivity by first converting RNA into DNA through a process called reverse transcription. This step is essential because PCR works on DNA, not RNA. Once the RNA is turned into DNA, the test amplifies the specific fusion gene sequences using specially designed primers, which are like molecular bookmarks that target the abnormal genetic material. PCR testing is incredibly sensitive. It can detect very low levels of leukemia cells in the body, even when they are present in tiny amounts. This makes it a vital tool for diagnosing leukemia, confirming the presence of specific genetic abnormalities, and classifying the type of leukemia. It also helps doctors monitor how well a patient is responding to treatment. By measuring the amount of fusion gene transcripts over time, clinicians can see if the treatment is working. A decrease in these transcripts usually means the therapy is effective, while stable or rising levels might suggest the disease is resisting treatment or coming back. Another important use of PCR is detecting minimal residual disease, or MRD. This means finding tiny numbers of leukemia cells that remains after treatment, which might not be visible with other methods like microscopy or traditional cytogenetics. Because PCR can detect these small amounts, it helps doctors decide whether additional treatment is needed to prevent relapse. Compared to older methods, PCR offers faster results and can find hidden or cryptic genetic changes that cytogenetic analysis might miss. It does not require cells to be dividing, which makes it more versatile and quicker. To ensure consistent results across different laboratories, an international scale has been developed, especially for measuring BCR-ABL levels in chronic myeloid leukemia. This standardization helps doctors interpret the results accurately and make informed decisions about treatment. In practice, the process involves taking a blood or bone marrow sample, extracting the RNA, converting it into DNA, and then amplifying the target fusion gene sequences with specific primers. The amount of amplified genetic material reflects how many leukemia cells carry the abnormality. This information guides doctors in diagnosing, classifying, and managing leukemia, providing a detailed molecular picture that complements other tests like blood cell counts and microscopic examination. Overall, PCR testing is a cornerstone of modern leukemia care. It offers precise, sensitive insights into the genetic makeup of the disease, helping to tailor treatments and monitor progress. If you or someone you know is undergoing PCR testing, it's always best to discuss the results with a healthcare professional who can interpret them in the context of the overall clinical picture. Remember, each person's experience with leukemia is unique, and medical decisions should always be personalized and guided by trusted medical advice.